Good morning. This is Jennifer Pierce, and I welcome you to the Health Literacy Solutions Center February webinar. I'll be moderating today and want to thank everyone for taking the time to join us. Before we begin, I will start reviewing some of the just housekeeping components just to get you oriented if you haven't joined one of our webinars before. And while we're doing this, we'll be transferring control of the slides over to our speaker. So don't worry, you haven't lost connection to the webinar. We have a wonderful turnout today. I will say that this is one of our best attended webinars. So before we begin, I just wanted to go over a couple of administrative points. Audio is provided through your computer speakers. There is no dial-in option. All attendee microphones will be muted for the duration of the webinar. So if you notice down in the lower right-hand corner of your screen, you should see a chat box. And if you don't see that chat box, just bring your mouse down to the very bottom of your screen. You'll see a little conversation bubble. If you click on that conversation bubble, it's in blue. It'll turn blue. That chat box should appear in the lower right corner of your screen. You can send a message to everyone, or you can send one just, just to me, Jennifer Pierce. But I recommend you send it to everyone. That way, others can see the question you've posed. I'll be monitoring that chat box throughout the webinar. We invite you to ask questions throughout. I'll be keeping an eye on it and will at the appropriate time introduce the question to our speaker. If you have a clarifying question, I may interrupt the speaker at that time just to get clarification. So feel free to use it at will. If you have any technical difficulties, go ahead and send a chat to the IHA host, and that should be the administrator listed on the chat function, or you can just type it in and I'll forward it on for you. The webinar will be recorded and the recording will be posted on the Health Literacy Solutions Center website. So feel free to not take notes and just be present and listen since the recording will be up. You will receive following the webinar an email letting you know when the slides are posted. And you will also receive a link to an evaluation form. So we do value your feedback. So take a moment to provide it. It's very, very brief. And for those of you who signed up to receive continuing education unit credit for today's webinar, you must submit a completed evaluation form in order to receive credits. The email states that, but just please be aware. So I believe we're ready to get started. As we get the slides transitioned over, I'm excited to introduce today's topic, which is always use TeachBack. Introduction to TeachBack will be covered. For those newer to the field, TeachBack is an essential tool for checking for understanding, and there's a lovely introduction at the start of the webinar, just orienting folks to the topic. So we look forward to reviewing some of the TeachBack resources that are available. The Always Use TeachBack Toolkit is an essential. If you are practicing TeachBack, it's a very rich resource that can be accessed directly from the Health Literacy Solutions Center, and we'll go over exactly how to get to it from the Solutions Center site. We'll discuss skill building resources, and finally, this is a first for our webinars. We will be gauging interest in having a follow-up session with Dr. Abrams, so folks can speak to what their experience has been like with the TeachBack Toolkit, ask questions, and receive feedback directly from our expert speaker. So we'll be using the chat box for all of that. During the presentation, at no point will anyone be unmuted. So please use the chat box function to communicate your interest, and I'll certainly prompt throughout the presentation. Let's see, looks like we're almost ready to move to slideshow mode, Dr. Abrams. And while we do
Jennifer,
that,
I'm having just a little problem.
okay.
All right, it's okay now. Thank you.
Oh,
Sorry
excellent.
about that.
Well, no, not at all, not at all. Well, I was going to go ahead and proceed with introducing you, and I'm so excited today. We have Dr. Marianne Abrams with us. She's a clinical assistant professor in the Department of Pediatrics at The Ohio State University College of Medicine and a GME Quality Improvement Medical Director and Primary Care Physician at Nationwide Children's Hospital. She led Iowa Health Systems, which is now Unity Point Health, Health Literacy Quality Initiative, and developed health literacy related interventions and resources, including the Always Use Teach Back Toolkit, which is a guidebook on building health literate organizations and online training. She co-chaired the American Academy of Pediatrics Health Literacy Project Advisory Committee and was a Pfizer visiting professor in health literacy. She is co-editor and contributing author to the American Academy of Pediatrics Plain Language Pediatrics publication and is published on implementing health literacy-based interventions, pediatric health literacy, and partnering with patients and adult learners. So obviously an expert in the field. Dr. Abrams, we're delighted to have you. Thank you. And I will now turn the presentation over to you.
Well, thank you. Thank you very much, Jennifer. And I really appreciate this opportunity to share this time with everyone on the webinar. And thank you all for taking your time to join us and also for the work you're doing to advance the field of health literacy. I'm going to take 30 seconds just to go back because we did have just a tiny little glitch. I'm not quite sure why, but we've overcome it in the slides. And I know Jennifer sort of outlined what we want to achieve with today's call, but I just wanted to reinforce that. I recognize that we have a lot of people on the call, and for some of you, TeachBack may be very new, and to others, you may be deep into using it and encouraging others to use it as well. So we're going to provide a great overview of TeachBack and some additional resources, discuss skill building resources, and then as Jennifer mentioned, and we'll again reinforce at the end, see if there's interest in any sort of a online sort of follow-up session where people can take some of these ideas and resources, apply them, use them, try them out, and see how it's working and maybe learn from each other. So with that, let's go ahead and move forward. I'm going to start out with just a few slides, which for most of you will probably be pretty familiar. And it's not so much that I'm going to be trying to teach basic health literacy, but I do want to underscore some what I think are really important points that I think are valuable when you are trying to make the case, so to speak, for encouraging others or to use TeachBack or expanding it within your setting and or in your organization. So looking at some of the data that we all know, but maybe coming up with some ways to use that information to advance this work. So we recognize that the National Assessment of Adult Literacy in 2003 provides the most current United States adult data, not only on literacy, but specifically on health literacy. And when you look at this pie chart, you recognize a couple key points. First, that the dark green and the horizontal lines make up the proportion of adults with below basic or basic health literacy. And that's a little bit over a third. About half of adults have what we call intermediate health literacy skills, and 12% fall into that proficient range. I think it's helpful for you to point out that proficient is not people who have gone to health profession schools. It's the kinds of, it includes the kinds of skills and tasks that we ask many people to do day in and day out. Almost anyone who works in an organization who needs to fill out forms and make selections, say their health insurance benefits, and look at a table and decipher that and make choices, that's what's considered a proficient health literacy skill. So the real takeaway is that only about 90% of US adults lack the health literacy skills needed to navigate the health system and health-related activities to make decisions and care for themselves or their families. So that this is something that is applicable across the board and affects everyone, not just certain people. The other thing is the evolving conception of what health literacy is. We know that the definition of health literacy focuses on the individual, but we're increasingly recognizing that health literacy reflects the product of those individuals' capacities, as well as the health literacy related demands and complexities of our healthcare system. And therefore, to address health literacy, that means that we must improve the skills of the system and how we communicate with people as patients, family members, employees, staff, communities, etc. We've got great underpinnings about why health literacy is critical and fundamental to quality and safety, beginning with the Institute of Medicine, now National Academy of Science, Engineering, and Medicine report on quality on health literacy, which one of its key findings reflected how health literacy is fundamental to quality care, and specifically to 3 of those 6 aims of quality related to safety, patient-centered care, and equitable treatment. And in addition, the Institute of Medicine Quality Chasm report identified self-management and health literacy as key cross-cutting priorities to improve the healthcare quality and disease prevention across our country. These are cross-cutting. They apply to all dimensions of health, whether it's acute, chronic, preventive, public health, etc. And there are a host of other entities that also support health literacy and health literacy related interventions and skills to support that work. Finally, as I mentioned, the Institute of Medicine has described those components of quality care. The Institute for Healthcare Improvement talks about the triple aim, where we simultaneously work to improve individuals' care and their experience, the health of populations at the lowest cost, and reduce waste. And health literacy is fundamental, again, to achieving those 3 dimensions. The Agency for Healthcare Research and Quality specifically refers to health literacy when they're talking about patient safety, which means freedom from accidental or preventable injuries. And so practices or interventions that improve safety are those that reduce the occurrence of those preventable adverse events. The Joint Commission, the safety of patients cannot be assured without mitigating the negative effects of low health literacy and ineffective communication on patient care. And the National Quality Forum endorses teach-back and reader-friendly documents to improve the effectiveness of a truly informed consent process. So there's a lot of fuel behind our efforts to improve health literacy and to address it in our organizations. The Institute of Medicine roundtable members also put together the 10 attributes of health literate healthcare organizations. I'm sure many of you are familiar with those. If not, I highly recommend that you do read those through, because regardless of what your organization is, becoming a health literate healthcare organization makes it easier for people, families, community members to navigate, understand, and use the information and services.
Dr. Abrams, this is Jennifer, and I'm hearing your voice kind of go in and out, so I'm wondering if your microphone is...
It's where it was during our practice, but I
Okay,
can...
excellent. Thank you. Sorry.
I'll just hold it.
Excellent. Thank you so much.
Is this better?
That's better. Thank you.
Okay, great. Just keep letting me know. To care for their health. I'm not going to go through all these 10 attributes, but several of them, incorporating health literacy into planning, evaluation, safety, and quality efforts is one of those specific attributes. And the other three that I think are most related to what we're talking about today is how do we prepare the workforce to be health literate? How do we use health literacy strategies in interpersonal communication to ensure and check for patient understanding? And in particular, how do we identify and use health literacy at high risk points to really make sure people understand? And I would invite you, if we had a little bit more time, to think about what are some of the opportunities in your setting where you can think about how health literacy relates to quality and safety. Is it looking at procedure-related incidents, medication reconciliation, discharge instructions, how we communicate with families through phone calls, patient portals, looking at our patient experience scores, clearly care coordination, and efforts to reduce unplanned readmissions, and absolutely to reduce health disparities and promote health equity. So hopefully that provided you with sort of some ideas about how you might be able to promote use of TeachBack in your setting. So let's say you've captured leadership's attention, or your manager or your colleagues or even your own. What do you want to do about it, right? So let's think about what we can do to address some of these issues. We're going to try a little interactive action here. I know we're not in the same room, but Jennifer is going to help us. I'm going to ask you to observe what I sort of call the traditional approach to a patient education experience. It's a brief video, and just kind of observe and see what you think, and then we'll ask you to share a couple of your observations.
So Nolan, like we talked about, you have exercise-induced asthma, which means you have bronchospasm, and it's an inflammatory process as well. And I'm going to give you this inhaler that will help you feel a lot better before you do gym or biking or things like that. It's very easy to use. I'm sure a smart guy like you will be able to figure it out. Basically, you take the inhaler, you stick it in the spacer, pop the spacer cap off, put your mouth on it, and that's it. Give yourself 2 puffs, but do them one at a time. And then you can do that 15 to 30 minutes before you're going to do strenuous exercise, and that will take care of all that inflammation and bronchospasm that's going to occur as part of your exercise-induced asthma. Okay? I'll send this to the pharmacy for you, the prescription for both the spacer and the inhaler, and then we'll see you for your physical exam next year. Questions about anything?
No.
It's great to see you. Have a good year. Don't be afraid to call if you do have any questions.
Okay.
See you guys.
See you. Thanks. What did he just say? I have no idea.
Okay, so I'm going to ask, can you hear okay? Is the microphone okay?
We can, yes. Yeah.
So take a minute and chat in some of the things that you saw in this encounter. And I can't see the chat, but Jennifer's going to kind of capture those.
Sure. Just as a reminder, if you hover your mouse over the very middle of your screen towards the bottom, there's the conversation bubble that will open the chat box, and then you can view. Oh my goodness, we're getting a lot of excellent.
I can kind of see some of those.
Can see,
They're
okay.
flashing up at the top, but they don't stay. So,
Sure.
so we
Let's
talked
see.
very quickly, used technical terms like bronchospasm, medical jargon, didn't ask Nolan to show back what he had learned or what he understood. Great. And before I realized I could see those, I probably missed a bunch too. And if we had more time, we would keep at it. Talk very fast.
I'm seeing no engagement with the patient or the patient's mother. Didn't seem to care.
And he didn't sit down. Okay. Great. Yeah, seemed like he was in a bit of a rush, right? He had his almost hand on the doorknob as he was walking out the door and said, "Do you have any questions?" Instead of "What questions do you have?" Right? All right, so let's see if I caught them all. Technical terms, medical jargon, gave a lot of information, and he did talk quickly. He asked a lot of yes, no questions. And at the end of the day, what did we see demonstrated, right? We got to hear a little peek behind the door, which showed that neither Nolan nor his mom understood what had been explained to them. Okay, so what, right? The visit was accomplished and the prescription was sent. Well, what can happen after that visit? Take a minute or two and send us some of your thoughts about what that could lead to by chat.
So what is the result? All right, we're seeing
Won't know how to use
appropriate.
this, won't know how to use this inhaler. He won't know when to use it. He won't be able to use it. May not know when exactly to use it.
I see not able to adhere to medication regimen.
Can he remember how many puffs? He may not use it because he's not sure how to use it. He'll come back for another visit a lot sooner than 1 year from now. Another visit to the office. Could have a serious event. Could have an asthma episode or attack that both the parent and the patient weren't communicated with. Okay, ER visits. Even the mom didn't understand. So it's not just, well, he's a kid, right? All right, so what else? We came up with a medication error. I saw that last little chat was he might be stressed about it. That's something that hasn't really come up before. He may make a mistake, but the stress, the worry, that's extra pressure. We often used to call it non-compliance, but now we use the word adherence. So he may be, told that he considered to be non-adherent when in fact he may think he's making the right choice by not using it if he's not sure what to do. He could clearly have poor self-management of his asthma, which could result in, as you pointed out, more visits back to his primary care doc, but he also could end up in the urgent care, the emergency room, and maybe even be hospitalized. And that not only is poor health, but it translates into missed school, missed work for his parents, extra expenses and costs, and ultimately poor health outcomes. So thank you for providing those insights and being so thoughtful as you watched that video. So what can we do about it? That's why we're here today. We're going to be talking about health literacy universal precautions, use of plain language in both written and a little bit in certainly verbal and a little bit in written communication. And at the end of the day, making sure people understand through use of teachback. So universal communications principles, or the universal precautions approach, really is based on several fundamental principles that clear communication helps everyone, even people who read well, who are highly educated, who are health professionals, benefit from clear communication. We can't tell by looking at someone whether they understand or not, and there are examples of health professionals who are confused by their information or don't remember it, so we can't make those kinds of judgments, and we don't want to use the valuable time we do have in the healthcare setting asking people to fill out yet another assessment, if you will. And the bottom line is anyone, including every one of us, can have trouble understanding and remembering health information, especially if we're sick or worried, been up all night with a sick child, are preoccupied, running late, have been waiting in the waiting room for 2 hours and need to get to work, maybe on some kind of medication that makes you a little bit less able to remember. There's a lot of circumstances that can address anyone to make anyone have low health literacy at a particular time. So the more efficient and appropriate principle is to use clear communication words and tools for everyone. And then you can always provide some additional help to those who need it. So what does that mean? What are these universal communications tools? Using plain language, slowing down, using shorter statements so we don't have these long convoluted if then do this statements. Really focus on the 2 or 3 most important things, which I find challenging, I admit. And again, checking for understanding using teachback. So what is plain language? It's clear. It uses only as many words as we need. It is not baby talk. It is not dumbing down. I ask you to join me in stopping the use of that phrase. It lets people focus on the message instead of the complex words and language. It does not mean that there's no place for beautiful writing or complex literature or technical terms in the healthcare setting or in the world. But when we need to communicate something effectively and ensure it's understood, we need to use plain language. So teachback is asking people to explain in their own words what they need to know or do in a friendly way. So I'm kind of bolding those key elements of teachback. It's not just asking people to repeat back or to parrot back. It's specifically asking them to explain using their own words, and also not a test of the patient, and how we convey that is important so that they don't feel like they've been put on the spot. It's a measure of how well you or I or we explain something. And it's a way to check for understanding, and if needed, to re-explain in a little different way, and then to check again. So don't just think, well, we did it once. They didn't get it, so I told them again, and then we moved on. You really do want to circle back, and sometimes that can be a little bit hard to remember. So your tone of voice, the friendly way, in their own words, taking the responsibility for being clear. The classic example of teachback is, I want to be sure I explained everything well. Can you tell me in your own words what you will do or tell someone so that I can be sure that I was clear? And there's other ways to use teachback. What will you tell your daycare provider about how to give Sam his medicine? Or if you're in more of a behavior change, health coaching type of conversation, you can use teachback and integrate it into motivational interviewing. We've gone over a lot of information and a lot of ways that you can get more exercise. In your own words, can you go over what we talked about and how will you make it work for you at home? So that way you're helping them to sort of set their goal and tying that together in their own words. It's also not necessarily just the clinician's role or need to use teachback. If it's important information, there are other places to use teachback, and other staff and roles should use teachback as well. So let's make sure this paperwork gets handled right. Can you tell me what you'll do with these forms? I want to be sure I did a good job showing you how to find the lab. Can you tell me what landmarks you'll look for? How will you go about finding it? And we want to be sure you understand what your insurance will and will not cover. That's a good one, isn't it? Can you go over it for me using your own words? This will help me know if I explained it well. Again, that's a really complicated thing. And by taking that burden off the patient, it makes it easier for them to focus on what they need to know or to say what they didn't understand. And if people have trouble teaching back, take a look at a couple other things. Make sure they have hearing aids in or their glasses on, or if they need any other kind of assistive device. They may want to include a family member or a friend. Clearly, if you need to access language services for interpreting, that is important. But think about cultural barriers and literacy issues if there's a reading burden associated with what you're covering. And other healthcare team members can help. It may be a standard operating procedure where you have a team member do the asthma education or the nutrition education or the medication review. It doesn't mean that one person has to stay and indefinitely try to promote this message. And sometimes it may take another visit or another call. And if they really are struggling, you want to make sure that other people who will be taking care of that patient or their family know about that down the road. Don't forget, if you are covering multiple topics, which we often do with chronic diseases, you want to focus on the 2 or 3 main points for the first topic, use teachback to check for understanding, and then go on to the next topic, rather than covering everything at once and trying to do one sort of big teach back. Ideally, you will have reader-friendly print materials to support the teaching, but even if you don't have plain language print materials, you can still highlight the handouts that you do give, put a star or a circle around the key information, and let them know exactly what you're doing and where, so they can find those key points later when they're referring back to it. Think ahead about what is the key information that you want teachback to be used for all the time. And then ideally, your electronic medical record or other system will allow you to document the use of teachback, and maybe even build in a way to assess how well the patient was able to respond, whether they successfully taught back or partially taught back, or were unable to do so. Think about teachback as an investment, not one more thing you have to do. I think we do spend time doing things that maybe don't yield good, don't contribute to adding value to what we're doing. So think about what you might trade off. What can you replace by using teachback, and build it into your habits. And some physicians that I know build it through little mini teachbacks as they go along. And they also, if you can get folks to use teachback a couple times, usually it starts to reveal itself to them that, oh, everybody seems to mix up when I say X, Y, or Z. So then that leads to them changing how they talk about X, Y, and Z, explaining it more clearly up front in a better way, and people tend to understand. So it can be very eye-opening and revealing. And ultimately, this is an opportunity to improve the health outcomes of our patients. One of the physicians we worked with in Iowa did several PDSAs related to use of teachback, related to changes in medications. And he was very surprised when a third of the people that they had made a medication change with were not able to teach back what that change was. And his conclusion was that without teachback, the only way to find out if a patient didn't understand could end up being a mistake that could ultimately be harmful. So I think that's another thing to bear in mind as you think about introducing teachback and sustaining its use. So how can you go about this? There's lots of wonderful resources out there. The ARC Health Literacy Universal Precautions Toolkit, a lot of wonderful resources. What we want to introduce you to and familiarize you with today is what we call the Always Use Teachback Toolkit that is now part of the Health Literacy Solutions Center hosted by the Institute for Healthcare Advancement. So Mario or Jennifer is going to show you later how you can access the toolkit through the Health Literacy Solutions Center along with other resources. You can also use the teachbacktraining.org to find it. And I'm going to explain a little bit to you about why it's called what it's called, and then walk you through the toolkit. So you're probably familiar with never events. Those are defined by ARC as adverse events that are unambiguously serious and harmful and usually preventable and should never happen, like amputating the wrong limb, operating on the wrong side of the body, those sorts of never events. Well, several years ago, there was this thought about, well, what should be always events? These are aspects of the patient care experience that are so important that providers should perform them consistently for every patient, every time. And that grew out of the Institute for Healthcare Improvement's work in quality and safety. So the idea behind this toolkit is to help make use of teachback an always event, to help all healthcare providers learn to use teachback whenever it is, every time is indicated, to support patients and families throughout the care continuum, and especially during transitions in care within and between different care settings. So the toolkit has about 4 key areas. There's an introductory piece about how to use the toolkit. There's an interactive learning module. There are tools to help coach others to increase or improve their use of teachback, and some additional resources. So using the TeachBack toolkit, there's a little video that tells you how to go about using it. And then there are two sort of stepwise approaches about how to use it. If you're working to improve your own use of TeachBack, it guides you through how you can use some of the handouts and the tools in it to help improve your own use of TeachBack. And if you're in a situation where you are overseeing another group or leading some work in an area, a department, a unit, those steps are, there's a few more steps, but it helps guide you through how you can use the tools in the toolkit to promote and measure increased use of TeachBack. The interactive learning module, first disclaimer I'm going to make is it says it takes about 45 minutes. I think that is inaccurate. I would say, depending on your experience, it probably takes 15 to 20 minutes. So don't let that make you worry. It's in two parts. It kind of gives you an introduction to TeachBack, and then there are video and self-assessment questions to help you recognize, confirm, and reinforce your ability to use TeachBack and to integrate it into your practice. Excuse me. And it follows, during that interactive section, it follows a patient that continuum of care. She's initially being discharged from the hospital. You follow her through a home health visit, and then through her primary care follow-up visit as well. So the goals of the learning module are to be able to define TeachBack, list the key elements of using it, to recognize some of those non-shaming questions you can use to elicit TeachBack, and then to think and demonstrate how you can integrate it into clinical encounters. Just a few quick screenshots of the different scenarios. You see the patient here being discharged from the hospital. This is a screenshot from her following up with her home health nurse visit, and finally following back up with her primary care physician. The supporting tools in the toolkit include this one-pager that incorporates 10 elements of using TeachBack effectively and a brief summary of what TeachBack is. The Coaching for Always Using TeachBack page has several videos and handouts that help support that overall concept of what TeachBack is, as well as providing tools for someone who's trying to help themselves or others improve their use of TeachBack. So there is a set of coaching tips if you are, again, in a sort of managerial role. There's an observation tool that you can use to observe someone using TeachBack maybe early on, and then rechecking later, a month later, and maybe several months later, because we again recognize that one-time intervention isn't going to result in permanent behavior change. So you really do want to sustain these interventions and make sure that new people who come on board or transfer over are also trained and understand how to use TeachBack in the context of your setting. Based on behavioral change and motivational interviewing, we've incorporated a conviction and confidence scale to help identify whether someone thinks that this isn't all that important. Then you really want to help them understand why it is important. And then the confidence, if someone's confident in one part of it, what do they want or need to work on to improve their overall confidence? And sometimes when we look at this on a bigger scale, we find that people are quite confident in their use of TeachBack early on. And then after they've kind of learned more about it, they're not quite as confident, which I view as a plus because it helps them understand that this is more than just a tell me what I just said type of an intervention. So bear that in mind if you would see those kinds of results. And then there are some suggestions about how to make sure, excuse me, that TeachBack is incorporated into long-term practices and policies so that it is always an always event. Just a screenshot of the conviction and confidence scale. You can see that you can check it whether it's before you start this work, 1 month or 3 months out, and it looks at some of the elements of whether someone has been doing it or plans to do it down the road. Here's the observation tool so that it breaks down those different components of TeachBack so that you can focus on the ones where more help may be needed. And a shot of the coaching tips. Just a couple examples that I found a little while ago of people who had reported using the toolkit in some of their improvement work. The first paper described a group in a hospice home care setting in a home care agency where they used the Always Use TeachBack Toolkit learning module and then some other materials from the Minnesota Health Literacy Partnership. They did a training. They used some of those observation and coaching tip tools that we talked about and observed that they saw improved confidence among their caregivers when they were taking care of the hospice home care patients. And they did see a decrease in hospitalization. Their numbers were very small. So whether that's attributable or not, but they did at least observe that, and that this was a very feasible intervention to use in that setting. And one other report was among nurses on some medical surgical units in a 300-bed hospital where they used coaching sessions. They used the ARC Health Literacy Universal Precautions Toolkit, as well as the Always Use TeachBack Toolkit and the confidence and conviction scale. They saw improved conviction and confidence and increased frequency of people reporting that they used the TeachBack elements, especially that piece about reteaching when someone was not able to teach back. And their conclusion was that this could also help as they tried to build a health literate healthcare organization. Finally, this is just the handout that is included in the toolkit that gives some examples of how TeachBack was incorporated into standards of care. So TeachBack was part of how our nurses cared for patients with pneumonia, and in their clinical competencies, they incorporated use of TeachBack so that that was part of what they were of that standard of care. It was also added to order sets at admission and discharge to remind people to use TeachBack at both points. And I don't believe I have a screenshot here. I know in one of my clinics, we had the prompt to use TeachBack, and that helped prompt us to use TeachBack. And I'll also say that we added a line that said, yes, they were able to teach back, no, partially, but we also included the line that the patient was not asked to teach back. And I think that's important because you may not always have the time, or it may not be relevant, or you just may choose not to do it. And that gives you the ability to say they weren't asked, as opposed to that forceful feeling of having to check a box, and then you don't know if your data are good quality. So just a little tip if you decide to go that route.
Dr. Abrams, I want to ask a very quick question. Laura has typed in, are the tools copyright protected?
They are not. The toolkit is in the public domain, and we do ask that people, a lot of folks ask about assigning the learning module to a large group of their staff, which is totally fine, but we do not want the learning module broken up or picked apart, so to speak. And right now, we're working on getting that wording on the website so that people don't have to ask specifically.
Wonderful, thank you.
You're welcome. I should say it's copyrighted, but it's available for use. Okay, so I may have misspoken.
Well, what a rich presentation, and I'm glad we have ample time for questions. And so I can see questions starting to come in while we ask and make some time for people to type their questions in the chat box. I had one related to having worked in a health system in a health literacy capacity. One of the key sort of pushbacks you hear is it takes too much time. So how do you counter that sort of complaint or pushback from providers who are already feeling squeezed in their brief appointments?
I, sorry about this. I go back to this slide that at the end of the day, why do any of us go to work, right? Ultimately, we are here to care for patients and families and to help improve their health and the outcomes of our community's health. And when I talk about healthcare organizations, I'm talking about clinics and hospitals. Yes, I'm also talking about public health departments and dentist's office and all sorts of health related areas. So when you look at some of the studies about teachback, the range when they have measured it, the statistically significant increases in time range from about 1.5 minutes to 4.5 minutes. Now, that may not sound like a lot, but I will be the first to admit that if you add, an extra couple minutes to 30 or 40 patients a day, that adds up to an extra hour. So it's not an effort to trivialize the little bit of extra time it may take. However, I go back to a couple other things. First, the discovery that we often find, I've heard this from more than one physician, that when they use teachback, they are surprised at what was not clear. So that gives you the ability to change how you explain that up front so that people will understand. So that's one piece. The other is building it into your practice patterns so that it becomes second nature, and thinking about what other places that by using teachback you may avoid interruptions. Mrs. Smith said she wasn't sure how to use those eye drops, or the phone calls, or the patient portal questions where people seek clarification. So think of it in terms of where you may be doing things that don't add value, and this actually helps in the longer run.
Mm-hmm.
And go ahead.
Oh, go ahead. Well, I was going to say, to your point of thinking about teachback as an investment that you mentioned, it's almost an upfront investment to preclude time spent on the back end clarifying.
Exactly.
Okay. We have a couple of great questions coming in on the chat. One is asking or stating, we do a preceptor course and discuss teachback. Not all of the preceptors are nurses, but all work in the healthcare system. Do you feel teachback is useful in all areas?
I absolutely do. And that for a couple reasons. First, everybody's on the healthcare team, even if you're not necessarily a clinical person. So back to this time question, that's where sometimes, like if I mentioned this example earlier, that you may have someone who's designated as to do the asthma education or the nutritional education or the medication discussions, so that it doesn't become just one person's job. It's not just the nurse, it's not just the quote educator, it's not just the doc, whatever. So everybody plays a role. And everybody's role is important. So everyone should be able to use teachback to help make sure people understand what you're responsible for communicating to the patient. That's why I gave those examples of the folks at registration, the folks on the front desk, the people on the telephone that give these kinds of directions, the billing office. How many complaints and concerns are there about my bill? Now, that's a pretty big challenge to know what your bill shows, but at least understanding what it will tell you, or what it can tell you or not tell you, could be important. Mm-hmm. So yes, I think it's very important. And also recognizing that sometimes people feel more comfortable asking someone who doesn't appear to be in a hurry, or maybe just looks like they're more willing to listen. And that's not to say that someone should answer questions that are outside their scope of practice, but they can make sure that they're clear about what they are explaining and make sure that they themselves understand and take that question to make sure someone else can answer it. Like Mrs. Smith down the road, down in room 328 has a question about her medicine. Does that help with that question?
I think it absolutely helps, and it's a lovely segue to the next question, which I'll pose. I just want to draw a parallel to a trend in healthcare now utilizing peers oftentimes in navigation, particularly in fighting opioid addiction, and the experience that even folks that are cleaning the room, housekeeping staff, for example, in the hospital, they're absolutely part of the healthcare team, and patients may feel more comfortable talking to someone who speaks lay language than to a provider. And this next question, I think, sort of gets to that. We train patients to volunteer and assist with quality improvement. Would this toolkit be a resource to train patients to observe and give feedback?
I think that is a great idea. We've talked about, and I've heard people talk about using or asking patients if they recall, or if they were asked to explain back in their own words what they were told, as part of a sort of an assessment of how their providers did at using TeachBack. But I've not thought about it the way the questioner brought it up, and I think that's a really great idea, because too often we put a lot of things together and then involve patients and families by saying, don't you just love what we're doing here? As opposed to, how can you help us take this or use this? Or how can we work together using this tool to help make our communication better? So sorry,
Many
I'm going back and
organizations.
forth here. I just wanted to pull up the observation tool. And I could see that very easily being, you might want to cut it to maybe 5 key things, and maybe see if that would be a useful way to get patient feedback. Because another useful point of that is it's a lot harder for providers to say, when they're actually hearing it from the patients themselves.
Right. And I know many health systems now use or have patient and family advisory councils, and I have heard many stories where the patient and family advisory councils are looking to do some meaningful work in the health system, as you alluded to. So this seems like it would be a terrific opportunity, and one of the sort of tasks or activities I could see this being used in is there's the bedside shift change, having perhaps a patient or family member observing teach back when there's a bedside transition at nursing shift change, for example. That's a trend, and it would seem to lend itself to a natural time to observe whether patient and family questions were answered in a plain language way, and understanding was checked for.
Yeah, and if what I like to call the essential elements of TeachBack were used, if there's a patient education component of that, and I'm always in a pediatric setting, so I picture the parent standing there while they're talking maybe to an older child. The parent could report back or note whether they asked the child, the young teenager or the older child, whether that child was asked to explain in their own words, and was it done in a way that made them feel comfortable. I think that's a great idea.
Just occurred to me too that a progressive health system could even let their patients know proactively, this is what we expect of our care team members. You can expect when you're interacting with a care team member that you're being communicated in ways that reflect the activities on this observation tool as well. seems like that it's a wonderful quality guide, potentially.
I think that's another nice thought because many of you may be familiar with Ask Me 3, which I think is another nice structural framework to use in this work. Because if you make sure patients get those 3 questions answered, what's my main problem? What do I need to do about it? And why is it important? You are making sure they get the information, that it's clear, and that they understand it, correct? So people have used that as a way to encourage questions, to say, did you get your questions answered? Do you know the answers to the 3 questions before you leave? I think you could do something quite similar with Teachback, especially as we more and more emphasize the expectation that we will treat all patients and families with that kind of respect and courtesy and engagement involvement.
Yes. Well, we have, Laura has typed in a wonderful response to a question I posed, which is how are you using Teachback in your organization? And I think this will sort of bring it home for us while we get to the end of the slide deck and wrap it up. She says, my DNP project is establishing Teachback in an urgent care setting in a primary Latino population within my organization. The need was identified by the low customer expectation scores for the question referring to received enough information on diagnosis and care management. One of their quality measures, it sounds like. Thank you for this webinar. So it sounds like we're getting some feedback here on the line. I apologize. It sounds like Teachback is a perfect example of it being a quality improvement tool for her urgent care setting.
Urgent care and inpatient and outpatient and many other settings. Yes, that's a really wonderful example. Thank you for sharing that.
Well, if I could get you, Dr. Abrams, to go to the very end to if we go back to this slide, I just want to spend a moment. I typed this into the chat box earlier, but wanted to stress that you can easily reach the Teachback toolkit featured in today's webinar via the Health Literacy Solution Center website. There are 2 ways to do it. First is on that navigational menu or the top pane on the site. You'll see a Teachback link there, or you can go into the communities tab, and there's actually a teachbacktraining.org community. And you'll need to be a member of the Health Literacy Solution Center website. It takes just a minute to sign up. It's free, and it opens up access to these wonderful resources in addition to many, many others. And so we invite you to do that when you have time. And if we can go to the next slide or our last slide, I just want to remind everyone that you'll receive an email containing a link to a brief online survey after the webinar. But before we sign off, Dr. Abrams has generously volunteered to take part in a sort of a part 2 of this webinar, an online discussion where you can share your experiences using the Teachback toolkit, the Always Use Teachback toolkit, share experiences with her, get feedback and expert advice from her on those experiences. So I would ask that anyone who is interested in taking part in that separate online event, if you would please just simply type yes. We don't need we can see your name, but just simply type yes in the chat box, and we will go ahead, judge the interest, and then go ahead and get something scheduled. We'll be in touch. But again, it's an opportunity to have an online follow-up session with Dr. Abrams to share your experience.
I would add one other thing. You graciously said learn from me, but also learn from each other, and I would learn from you, because one of the ideas behind this is that you would deploy some of these tools and then share your experience, your successes and your challenges, and we would be able to learn more from each other. And if I have one more second, we will also be having the half-day workshop at the beginning of the IHA conference in May on the toolkit and go into much more depth, similar to what we're talking about here.
Wonderful. And again, conference registration is open now. Well, we are at time. Again, you'll receive an email when these slides are posted. The evaluation, we value your feedback. And you can also start registering for the Building Health Literate Care Through Meaningful Patient Engagement, our March webinar. So block time on March 26th. Dr. Abrams, I thank you so much for your time today. You can see from the chats, this was valued by everyone who attended. We appreciate your expertise and your generosity sharing this knowledge, and want to wish everyone a lovely afternoon, and again, appreciate you joining us today. Thank you.
Thank you very much, and thanks to all who joined us. Jennifer and Mario, thanks for your help. Have a great day.
Thank you.